So first of all, I would like to start with this plant, Colovanthus cuitensis. So it's a very advanced organism who's able to get like the proper adaptation, especially with very, very low temperatures. It's basically like one of the local vegetation in the Antarctic. Unfortunately, with all these climate changes, the population is growing, affecting drastically all the environments and all the population with related with animals, like food consumption, resources, etc. And this is only the tips of the iceberg about this a problem. So let me just try to. So as yes, so and actually this is a recent study from last year, 2022, describing this kind of situation, that this abnormal growth of this microorganism is affecting all the ecosystem. And this is only one example. So as you can see, this climate change is not affecting one specific area. It's a global emergency that we should consider as a physicians, as a healthcare providers. We need to be aware about this situation, no? And recently, like a WHO has suggested to consider these global change as a global emergency. Basically, the climate change, what's happening basically in the Antarctic ecosystem. So basically, the temperature is increasing. So the melting ice and sea levels is increasing as well. So the change in the biodiversity, so the altered ecosystem, so it's causing like many issues. Okay, and basically the reasons are related with the air pollution, deforestation, so like a massive growth of the human being is contributing to all these kind of things. What is this issue is causing? So it's affecting the vector ecology, extreme heat as previously was exposed. The population is having like a more cardiovascular diseases, impacting the water and food supply, increasing allergies, degradation of water quality, etc. So as you can see, it's not only one problem. Everything is like a correlated. So this correlation, we affect one of the chain of one of the elements of the change. So of course we will affect the whole environment. So understanding the dengue fever, I would like to focus on dengue fever. This is the main topic of this talk. So as you know, like dengue fever is a mosquito-borne viral disease prevalent in the tropical and subtropical regions around the world. It's caused by the dengue virus, which has 4 distinct serotypes: dengue 1, 2, 4. And recently, like it's documented in the medical literature, dengue 5. Found in Malaysia in 2013. It's not very well defined as a specific serotype, so that's why I'm only mentioning these 4 like a confirmed serotype so far. The virus is primarily transmitted through the bite of an infected female Aedes aegypti mosquito, basically. I thought Aedes albopictus mosquitoes can only transmit the disease. Okay, so this is like a basic things. Talking about the virus, so as you know, the dengue fever is part of the genus Flavivirus genus in the Flaviviridae family, and it's an enveloped virus with a positive sense single-strand RNA genome with about like 11 kilobases in length and approximately like 50 nanometers. And talking about the structure, so we divided in structural proteins and non-structural proteins. So structural proteins basically are formed by capsid, pre-membrane, and envelope. C protein it's for the nucleocapsid, capsule the viral RNA. And the PRN proteins are acting as a chaperone for E protein during virus assembling, and E protein involving the virus attachment and entry, primary target of neutralizing antibodies. I'm talking about the non-structural proteins. So we're talking about like NS1, NS2A, NS2B, NS3, NS4A, to etc. The roles basically involved in the RNA replication, protein processing, and evading false immune response. Examples, so for example, NS3 has protease and helicase activities, and NS5 is RNA-dependent RNA polymerase, and NS1 is secreted and aids in immune evasion. And it's very, very important NSA for diagnosis as well. So about the serotypes and immunity, so these serotypes are closely related, but differing in antigenic properties. Immunity, infection is one of the serotypes providing lifelong immunity, but only temporarily and partial protection against others. And as you know, like subsequent infections with different serotypes increase the risk of severe disease due to the antibody dependence infection, or ADE. And that's why, okay, most of the times, the second infection could be worse than the first one. Okay. Talking about the genetic diversity and variability, so then the genome shows higher genetic diversity with multiple genotypes and lineage serotype. And the impact interaction between virus, host, and environment coupled with genetic diversity contribute to variability, okay, in diseases severity and epidemiological patterns based. Okay, the symptoms of dengue fever, we know about it. So like the fever typically begins 4 or 7 days after the mosquito bite, and usually could last between 3 to 10 days. This is the famous like a bomb break the fever, because like all the patients complains about very severe like myalgias. So they can range from mild to severe, and may include high-grade fever, as I told you before, severe headache, pain behind the eyes, joint, muscle pain, rash, and bleeding in severe cases. And at the same time can develop like hemorrhagic fever or dengue shock syndrome. It can be life-threatening. And there are some forms that this is my main concern that could be like a completely asymptomatic, especially in young people. So then the dengue fever is endemic in more than 100 countries, influenced by climate, urbanization, and mosquito vectors. And there are like some reports from since 1780s and severe forms like DHF or DSS emerged in the mid-20th century. About like 100 countries affected, so expansion linked to urbanization, as I told before, travel and trade. And the challenge, no specific treatment, unfortunately. Prevention focus on controlling mosquito vectors, and this is our main concern about it. So like to try to control the mosquitoes. So the future concerns, of course, like dengue identified as a future health concern due to urbanization and environmental changes. So then this diagram resumes the situation with the dengue virus infection. Basically, these two factors that we need to control: the viral factors and the host factors. Okay, and we will discuss about it during the following minutes. Talking about the damage to the specific organs. So basically, the dengue is able to create like a massive edema, especially in lungs, spleen, liver, but at the same time is creating or causing like a micro and microvascularity and severe like damage. In some cases, necrosis. Okay, this is a very interesting article, okay, from Brazil. So the people from Rio de Janeiro University were follow multiple biopsies, especially in post-mortem, and they analyzed the specific damage on specific organs. You know? And all of these people concluded the same. So the microvascularity is affected in a very severe way, and at the same time they detected like a massive growth of the virus, especially using like immunohistochemistry focus in the presence on the protein NS3. So they realized that the damage are like a massive in lungs, okay, in liver, something like quite similar, okay, the same problems with the wet vascularity. So in the heart, okay, I will not be focused on this topic, but this is basically the images and the conclusion. Okay, the spleen, same damage, and the kidneys. The study concluded that basically the kidney somehow they couldn't detect like a massive growth of the virus, so there was no like viral replication in the kidney tissue. So this could be like another reason for like a further investigations about what is the factors, okay, around the kidney the kidney tissue that could be inhibit the growth of the virus. So this is like a very interesting study for further studies. I mean. So according to the World Health Organization, the global incidence of dengue has grown dramatically in recent decades. So about like half of the world's population is now at risk. Okay, and basically the most affected countries could be like India, China, Brazil, Indonesia, Bangladesh, Pakistan, etc. So as you can see, the growth is like massive. So we need to try to do something about it, because despite of the global prevalence and severity of the dengue fever, there are currently no specific antiviral drugs for treatment, and prevention is primarily focused on the vector control measures. Okay, so this is like another graphic, okay, that is showing the massive increasing of all these things. Okay, so the climate change is playing an important role, and it's very well identified all the elements responsible for this spreading of the mosquito, that is the vector of this disease. Basically, rising temperatures and other rainfall patterns create like the ideal breeding conditions for disease vectors. Altered rain patterns and mosquito behavior, so increased rainfall creates breeding sites for mosquito, especially in urban areas. Okay, so what does that mean exactly? So like the temperature increase, so this situation increase like the mosquito growth. Okay. And this, of course, is causing like a lot of problems. And this is something very, very important. At the beginning of my discussion, I told you that basically Aedes aegypti was responsible. In some cases, Aedes albopictus. Okay, but in some areas right now with this global warming, so we are experiencing like another like a very concerning point. Any other species of mosquitoes, specifically these two types, okay, like Aedes polyniensis and Aedes niveus, okay, are like are positive as well for dengue virus, and could be like another vectors that previously were not considered. So this is another thing that we need to consider, like probably in the future we will not be concerned only by Aedes aegypti and Aedes albopictus. Okay, so we need to be careful not to try to create habitats for these mosquito populations. Okay, so this is the current map of dengue virus transmission. So as you can see here, Oman is located, so it's in the Middle East. Okay, we're neighbors of Yemen, Saudi Arabia, and UAE, basically. Okay, and here the situation according to this map, okay, from 2016 was not very concerning. So the number of cases were like controlled. So this is one of our main concerns in Muscat. So as I mentioned before, the acceleration of the mosquito life cycle and breeding rates. So recently the temperatures are rising, accelerating the mosquito breeding cycles. So just to give you one example, all the cycle, okay, in a normal temperature between 25 to 30 degrees Celsius, okay, could take between 2 and 3 days approximately. If we increase drastically the temperature in the peak months, okay, we can reach like more than 40 degrees with a very high temperature, more than 85% of humidity. So this situation and this cycle can be reduced to hours, between 24 to 36 hours. So can you imagine the impact when we increasing the temperature, we reduce the rate of this life cycle? Okay, so it's like a very, 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 very big problem, you know, to try to control the vectors in our country. So at the same time, so urban challenge, the disease spread. As I told you before, you will mention like problems with asymptomatic patients. So we need to tackle all these situations. Human mobility as well is causing like several issues. So there's an article released like recently about that, but they describe only like these human conflicts. They describe it like Ukraine and Russia, Afghanistan, and Syria. Okay, that all the situation is like causing disruptions in the flora, in the way that the humans are moving from one place to another. Mostly of the time without the proper like healthcare conditions, without the proper like control, like from the infection prevention and control measures, so are not like properly implemented. So this could be like a very good, a very concerning problem as well. So again, the population, immunity, and disease outcomes that I will not mention again. So like these could affect as well. Okay. So we will discuss about what happened in Oman. As I mentioned before, so like in the Oman's climate patterns, it's a very hot and arid climate with temperatures exceeding 40 degrees. So first of all, we need to think about the mosquito. So the mosquito cycle is very, very fast. So seasonal monsoons, they call it Kharif, bring heavy rains and cooler temperatures, especially in Dhofar region. A rise in dengue cases in Oman between the 20,000 versus 2022. It's showing like a very severe increase in the dengue cases. Okay. So talking about like dengue fever in Muscat. So it was recently one outbreak last year. So demographics affected, symptoms were observed, and geographical concentration was monitored. The control measure and the community impact, the government established the proper strategies during to try to control the outbreak. And these data, for example, are coming from our official data from the Ministry of Health in Oman. So as you can see, okay, it will basically this list is they are like reporting the principal typical disease. So we can see here the dengue. So it just comes from 2020 to 2022. Let's analyze the cases. In 2020, 300 cases. In 2021, during the COVID pandemic, 24. Okay, but look at this drastic increasing of the number of cases from 24 to 1989. So we're talking about like an increasing about like 8,000%. Okay, we need to be careful in the way that we're interpreting these results. Okay, because as you can see, like a 24. Okay, could be like due to many reasons. Basically, the COVID pandemic. So like we focus to try to tackle this global pandemic in our healthcare system. And at the same time, so all the people like used to be inside of their houses. So the detection and the proper diagnosis was not properly done. So this could be one of the reasons why the numbers were so low. So don't think that the 2021 was a very good year for dengue. Okay, so talking about this, there's a very interesting article that describes the outbreak in Oman in 2022. And the group of Dr. Al-Baluchi and collaborators describe what happened exactly in Muscat region, that is the capital of the Sultanate. Okay, and they describe and they were monitoring in different areas, especially in Al-Si, Bushar, and Matra. Okay, so like it's basically the urban regions of Muscat. Why they got, so basically like they reported approximately like 69 cases. Okay, so basically, as you can see, the most affected population were within the 21 to 60 years. Okay, approximately like 63% were like a male. Okay, Omani versus non-Omani. Well, it was like a balance. Okay, and the district of residence, so basically like urban areas. Okay, the clinical features: myalgia, headaches, loss of appetite, vomiting, and abdominal pain that we already described. The epidemic curve, it was between March to April, so approximately the peak were within the three weeks until the government established the proper measures for like informing the populations, for fumigation in the main areas. Okay, they reduced the number of cases. So the lessons learned during this outbreak, so it's basically emphasizing the importance of public awareness and preventive measures. It's very, very important, okay, to compromise and to try to involve and engage the community. It's very, very important to give information about it, okay, to know how to tackle the infection, to know about the vector, okay, and to let them know about the symptoms that could lead to the proper diagnosis. Okay, so of course we need to be aware about the community impact, the demographic effect and economic implication on the working age population was very, very, very severe because they needed to be at home, okay, and they cannot work. So this, in a massive way, it's affecting the situation and about the economical situation. And the public awareness initiatives and the need for sustaining education and engagement, it's a must, of course. And not only with the dengue fever, I'm talking about the whole infections related with the global changes. Okay, so the recommendations from our side. So it's very, very important on multi-sectoral approaching, reiteration of the importance of collaboration about various sectors for effective dengue control, need for more data and innovative interventions, and emphasizing the importance of research, data collection, that is very important in these cases, okay, and innovative strategies for long-term solutions. Basically, what are we recommending? So, like, what is the future of this? Okay, so it's I mean, we already concluded that the climate change is it's a fact. So we need to do something about it. So, but from another side, we have technology. We have like a communication, so we have like a awareness, and of course, like we're currently involving the population. So we need to use like a smart sensor technologies, big data analysis about the climate change, about the monsoons, about like for example, use like a satellite imaging, community-based surveillance, okay, engaging local communities in disease, give more information, providing more like guidance, okay, where to go, how to tackle this infection, how to detect the symptoms, okay, the improved diagnosis, so the point of care, so distribute the proper like rapid test for the population, so establish like a very, very specific and very strategic distributed like laboratories for like a quick diagnosis, for a quick PCR, for the proper detection, for like, I don't know, many other things that we can do in order to try to do this diagnosis faster. Okay, serological markers, identify all these kind of things. And another point, like innovative vaccination strategies. During the COVID pandemic, we realized that the vaccination is a reality. I mean, the quick vaccination, to be more specific, is a reality. So like right now, from the technology used on the COVID vaccination, so we are using right now like new technologies for developing like a new vaccination, currently approved by the FDA and currently using, where we have like a one dengue fever vaccine. That the current dengue fever vaccine has a lot of limitation in terms of like the patient needs to be between like 9 to 45 years, okay? Previously unconfirmed detection, so that means that we need to get like a proper serological studies, okay? And of course, like the coverage and effectiveness of this vaccine varies like drastically depending on the serotype. For example, the dengue type 3 and 4, the efficacy of these vaccines goes between 70 to 75%. And if we are talking about the dengue type 1 or dengue type 2 serotypes, so we are talking about that is effective between 45 to 52%. And if we are considering that the most frequent serotype is dengue 2, so this vaccine is not very promising in the long term. This is like a very good area of opportunity to develop like a new vaccinations. Okay, so as you can see, there are like many things to do. Okay, so like a global warming is a fact. Okay, we need to identify the areas of opportunity. Okay, involve more the population. The population right now needs to be an ally. Okay, in order to try to control the vectors, control the disease, okay, and of course, like be able to detect the disease as soon as possible. Okay, so this is basically like the basic things that we need to do. Of course, there are so many things to do, and of course, we are only talking about only one infection diseases. And if we are considering this vector, Aedes aegypti is able to disseminate as well chikungunya, if you remember, and of course, like a Zika virus that you heard before in Brazil. So we need to be careful about the vectors, okay? And of course, like I try to provide like more information to the population. So this is the most important. I would like to conclude my talk with a quote from Margaret Mead. If you don't know her, it was a very famous anthropologist and sociologist. And she said, like, I never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. Muchas gracias.